Good morning to all of you. Today is World Diabetes Day. The theme of World Diabetes Day 2022 is Education to Protect Tomorrow. We are giving so much of importance to a person who is living with diabetes mellitus. A person who is having a long history of diabetes mellitus, if at all he or she doesn't follow a lifestyle modification, if they are not taking medicines properly, definitely it will end up in diabetic related complications like neuropathy, nephropathy, retinopathy and other microvascular complications. Whether we are giving significant importance to a person who is in the pre-diabetic phase, the pre-diabetic phase, the name itself denotes that it is the stage just before the manifestation of diabetes mellitus. It is also called as reversal stage or window phase, where if the patient gives more importance, it will not convert to a stage of diabetes and finally it will not lead to complications. Today I am going to speak which are the patients need to be checked for pre-diabetes. Number one, if you are having a high blood pressure, if you are having high lipid values, hyperlipidemia, if you are having fatty liver, if you are having obesity, if you are having metabolic syndrome in the sense means your low density lipoprotein and triglyceride values will be very high, your high density lipoprotein values will be less than 40, at the same time you will be having abdominal obesity along with hypertension. So if at all you are into these criteria and parameters, definitely you will be in the stage of pre-diabetes. Next I am going to say about the criteria to analyze pre-diabetes. Three criteria are there. Number one, if your fasting blood sugar is ranging between 100 to 125, if your HbA1c value ranges between 5.7 to 6.4, and PPBS means postprandial blood sugar, it is the blood which has been checked after 2 hours of intake of a meal. If it ranges between 140 to 199, you will be in a stage of pre-diabetes. You need to be checked and you have to take care of. Next, regarding the management of pre-diabetes, the main thing is exercise. Brisk walking, 10,000 steps a day advised. Otherwise swimming at least half an hour a day advised. Reduce the intake of carbohydrates, refined sugars, sweetness, corn sugars, corn soups, etc. advised. Then you have to do yoga daily, at least for a time period of 1 hour, along with meditation, which helps in maintaining your glycemic index. And also you can take amla powder. Amla is gooseberry amla powder, 1 spoon with 1 glass of warm water. You can put 1 pinch of turmeric powder into it. You can take twice daily, morning empty stomach and night time after food you can take. Also you can take Triphala churna. It is a combination of 3 fruits, Terminalia cebula, Bellarica and Emblica officinalis. So 1 spoon of this Triphala along with 1 teaspoon of turmeric powder mixed together, mix with 1 glass of warm water, take daily 2 times, 1 time in the morning before food and night time after dinner. And also intake of garlic is also very important, because in pre-diabetes there will be insulin resistance, so that the glucose will be much produced in the system. This glucose will be converted to lipids and stored in the liver as fat. So in order to convert this fat which is stored in the liver into fatty acid, garlic is the best source. So garlic, which contain allicin, when we chew this garlic, this allicin will be converted to allicin. This helps in the conversion of triglycerides to fatty acids. So these are the and also you have to take vegetables, leafy vegetables and fibers. These are the important things which you can do in order to maintain the phase of pre-diabetes, so that it will not convert to a stage of diabetes mellitus. Thank you.